Hello, this is Ryan Plastic Surgery Clinic. I'm Dr. Sang-Moon Choi, and can you introduce yourself to the viewers?
So I'm Emily Morgan and I'm from Melbourne, Australia.
Thank you for coming and thank you for the interview. So what made you to come over from Melbourne to Korea, and what was your reason to choose Ryan Plastic Surgery Clinic?
I was looking for a cosmetic surgeon and I found that Korea has a really good reputation for cosmetic surgery. So I decided to research medical clinics in South Korea, and that's when I found Ryan Surgery.
Well, I was very amazed because she came a long distance and by herself. You came by yourself, didn't you?
Yes.
And I was like, it's your first time visiting Korea?
It is my first time visiting.
Weren't you scared?
I was a little bit hesitant because I was concerned that there would be some kind of major language barrier and I would struggle to communicate, but I found that luckily for me, people were able to communicate quite well in English because my Korean's not too good. So I was pleasantly surprised.
We used the method Prison-Bay, which has hydrodissection and minimal invasive surgery. What was your personal experience about this surgery so far?
Yes, so one of my concerns as well was the recovery and pain. I was anticipating to be in quite a lot of pain after surgery, and I was really surprised because it was quite painless. I would rate it about a 1 out of 10 for pain.
So you also had mastopexy one side of your breast. So what was the pain? What was it like after doing the mastopexy one side? Was it more?
One side was more painful due to that procedure. I was prescribed medication to take afterwards, so it wasn't unbearable. It was just maybe a 5 out of 10, and then it settled quite quickly.
We try to make your breast as much as high level because we had to lift up your breast. So yes. Right now it's going down gradually, but when you see the result after the surgery, was it more than you expected or was around your expectation?
It's better than I expected. It's a lot more natural looking and I'm really happy with the results.
You also saw the incision areas?
Yes, and the incision area is really small as well.
I'm so glad you liked the results. Can you a little bit explain what you did during the visit?
Post-surgery, I was still recovering from anesthesia, so I was quite drowsy and sleepy. I just went home to rest, and after the one following day, I was able to walk around and do some sightseeing. So I went to some traditional markets to buy some souvenirs for families and friends, and yeah.
So if you go back, if there's a time machine, if you go back and decide where to have the surgery, would it be the same?
Yes, definitely.
Wow.
It's an easy choice.
Easy choice. Oh, yes. Thank you so much. I was very astonished and surprised, and also very honorable to have a client from Melbourne, Australia. There are a lot of reasons I do combine fat graft during breast augmentation. It's because the implant also enhances the volume of the breast, but it has limitation because the implant has a certain shape. It's just round, so it can't go to the center of your breast. So she needs more enhancement at the center of the breast, so I take out the fat from her inner thighs and added volume at the cleavage area and also a little bit at the upper side because she needs more volume at the upper pole of her breast. Yeah, that's the reason why I did fat graft during the breast augmentation. And this is a very common thing that we do in our practice. It is getting more popular. I think a lot of doctors in Australia also doing this the same way, and since it's her own fat, it's very safe. So what is your the most different thing that you feel before and after the surgery of your breast?
So the major difference I felt was the shape and the size of my breasts, because after my pregnancy and breastfeeding journey came to an end, I noticed there was a lot of difference in my breast shape. So I wanted to restore it, and now I can feel like it was before.
I want to revive your breast,
yes.
While doing the design, I want to make your breast look younger again. That way you can wear bikini or swimsuit when you go outside.
And even dresses that have a lower V-neck. I've struggled to wear that before because I didn't have much breast anymore. So yeah, I'm really grateful with these results.
I'm so happy that you can change your lifestyle after the breast surgery and also have a different like dressing like outfit style later on. Is there any particular you think about or you remember during the recovery period?
It was quite a smooth journey. I think the transition to like sleeping on my back was something new because I tend to sleep on my side, but because I was quite tired, I got used to it pretty quickly.
Good aspect of using Preserve technique is that I don't cut the ligaments. I just expand the ligaments. In that way, it's not like it keeps the framework of your breast, so you can lean to sides. But
I was worried it might change the direction of
no. The one good thing about Preserve is remaining your ligaments and also your soft tissue. So actually using hydrodissection, which is making the pocket with tumescent solution, which is normal saline with anesthesia and adrenaline for adrenaline for vasoconstriction. So actually, I try to preserve your own tissue as much as I can. So you can lean to sides, doesn't matter. And also you can do running or marathon.
Oh, that's great.
Later on, yeah. So that's the good aspect of doing Preserve technique. Well, I think Emily had a wonderful experience doing Preserve breast augmentation, mastopexy, and fat grafting hybrid breast augmentation. I hope you enjoy your result, and I hope this experience might enhance and fulfill your daily life.
Yes, absolutely.
Thank you for
Happy.
coming.
Thank you for seeing me.
Thank you so much.
Thank you.